everybody, this is Brendan from the Exercise Therapy Association, and I'm here to talk to you about the importance of footwear in order to help your clients get the best results in the gym and in order to help you get the best results biomechanically. I have Andrew here holding his shoe, and if we take a look at this shoe, a simple assessment that you can do at home starting today is to take a look at the slope of the footbed. Now we can see with Andrew, with your shoe here, if we pinch it here, we can see that it's a little bit bigger at the heel end of the shoe, and it's a little thinner as we move forward. So we would describe that as a downward sloping footbed. Now, everything is stacked on your shoes when you're standing in them, so they can heavily influence your biomechanics. Let's take a minute to consider the relevance of a downward sloping footbed. If Andrew is standing on those shoes, it's going to shift his weight forward a little bit. It's going to cause a little bit more tension in the quads, and that anterior tension is going to work its way all the way up. This is a big concern because a lot of you may be familiar with lower cross syndrome. Lower cross syndrome is when somebody has a pelvis that is tipping, just cross your arms like that, there you go, give yourself a hug. Lower cross syndrome is described as a pelvis that is tipping excessively forward like this. Okay, now if you have shoes with a high heel, you're going to tip them further into the dysfunction. And then if they're training in the gym like that, you're strengthening them in that dysfunction with the compound exercises when they're standing in these shoes. This is a very important thing to consider when you're programming for your clients. If you're trying to activate the glutes and the posterior chain, you're putting yourself at a disadvantage the minute you walk into the gym with improper footwear. So, once again, we have Andrew here, and we have Andrew's shoes demonstrating the slope of the footbed as a consideration for programming for you and your clients. I'm Brendan from the Exercise Therapy Association. We're here because we're rooting for you, and